Dr. Eric Woolley joining us, podiatrist at Prairie Lakes Podiatry Clinic, and we're going to talk about foot health. But Doc, before we do that, tell us a little bit about Dr. Eric Woolley and how you got to be where you're at today, and what's a podiatrist?
Yeah, my name's Dr. Woolley. I actually have been out here in Watertown for coming up on 6 years now. I grew up in western Wyoming, and then life has taken me all over since. I've ran equipment in Alaska for a few years, did some business stuff, and then decided to go back to school. Ended up in Philadelphia, Colorado, and then here. We were looking all over the country for different places to practice, and we came to Watertown in February 5 or 6 years ago, and we came anyway. But we fell in love with it. We left and we thought, we didn't think we'd like it that much. We thought, we'll just stay for a year or two, and here we are, and we don't plan on leaving. It's been a great community for us. We've loved it. My wife and kids really enjoy it here. And as far as what a podiatrist is, skipping ahead to that question, I'm a specialist in lower extremity care. We do anything from wound care, ankle sprains, fractures, bunions, hammer toes, the works. So anything below the knee, we're happy to help out and care for in whatever manner we can.
And why is it important for us to be healthy, and I'm going to say it, below the knee like you described?
I think it comes down to a lot of it is mobility and functionality. If we're having issues, any of us who have had a problem with your lower extremity, it's hard to get around, it's hard to complete your activities of life, your job, your work, your family, and be able to function at high capacity. So I think that's probably the most important point, is to be able to do what you need to do in life. And if you've ever had a problem, it's hard to get much done if you can't get around and walk very well.
What are some of the common foot health problems that you deal with as a podiatrist?
This time of year, it seems like we get a lot of ankle sprains and injuries like that with people trying to be more active with the change in the season. We see a lot of plantar fasciitis, flat foot, diabetic problems, bunions, different things like that. So plantar fasciitis is an inflammation of a ligament in the bottom of the foot that attaches to your heel bone. Most folks will say, I have this really pretty severe pain when I first get up out of bed in the morning or when I get up from my desk at work, and it hurts heck. And then once I get moving, it gets a little bit better, but as the day goes on, it just starts to kind of add up and be awful. Again, a very common condition, but it responds very well to conservative treatment. It's something that with a stretching regimen, some inserts, some icing, and some anti-inflammatories, for the majority of people, we can get this resolved in a couple of weeks. It takes a little bit of homework, but most people respond very well to conservative care. For those that do all those things and still struggle, we can employ physical therapy, which we've got a great department for that. Oftentimes I'll do a steroid injection that can be helpful. And only a small number of people actually need surgery for plantar fasciitis, but again, it's a small number overall. Probably 95+% of people get better from this with conservative care, but it can be pretty debilitating. So a lot of folks, when I meet them in clinic, they'll say, there's no way these simple things can fix this. I hurt too badly. But it's pretty satisfying to see when they go through the regimen that they do well.
Doc, another thing that can be painful is gout. What's gout, and do you treat that?
Yes, absolutely. It's something, this is a condition that oftentimes we see run in families. People will say, my dad or my uncle so-and-so had that. And what it is, it's a buildup of uric acid, and I'll spare you the boring details of the pathology of why it happens, but it presents in most people as a red-hot swollen joint. Now, most commonly, it's the big toe joint, but I've seen it in the midfoot and the ankle as well. People will say, geez, this came on all of a sudden, and I felt like I was dying, like I was being stabbed with a hot knife. A lot of people will, geez, I must have some type of infection and so forth, but this is something that can be confirmed with a blood test. Oral steroids or injections can be beneficial for it. It is something that can wax and wane and is often influenced by diet. So there's a few different things that we have people try to avoid and abstain from, or at least reduce in their dietary intake that can cause gout. But if diet modification is not sufficient to reduce the instance of, we call it flares with gout, that it can come and go, then there are some oral medications that can be taken long-term that are beneficial and can prevent gout from happening.
Are most of the things you deal with simple to treat? What are some of those, and what are some of the more serious ones, and how do you treat them?
I would say it really varies. There's certain things like plantar fasciitis, as you mentioned, can be pretty straightforward and works very well. Some of our anything that's trauma, sprains, fractures, tendon ruptures, etc., are generally surgically treated, and that's a little bit more complex. But overall, I would tell you our overarching goal is to treat things as conservatively as possible. I tell all my patients, I'm your newest employee. I work for you. You got to tell me what we're going to do. I'll present you with all the options, but ultimately patients get to decide. Now, if you have a fracture and a bone sticking out, that's a little bit different story. I'm going to tell you surgery is probably a really good idea. But if you've had a sprain and we want to try the conservative route, if you've got fasciitis, et cetera, there's a lot of things that we can do that are fairly non-invasive and not too traumatic as far as treatments go. But then certain things, more severe pathology usually requires more, we'll call it intense intervention.
Doc, what are some things we can do to maybe not have to come and see you?
I always tell everyone, too, the best place to see me is at Menards or somewhere else. If you're coming to see me in the office, something's wrong. But I tell people that making sure, especially this time of year where we're coming out of the colder season and it seems that we're all anxious to get outside and be active and do more things, that it's important to make sure you're warming up, having a little bit of a stretching regimen to loosen the tissues up and get our flexibility and mobility back from these winters that we have. Granted, this was a pretty mild one. Another thing I would say is just make sure you're wearing appropriate shoes for what you're doing. If you're out in the field, on the farm, or things like that, wearing something that's a higher top lace-up boot is a good idea. You'll have a lot more stability there than wandering around in old sneakers. Same thing for your sporting events. Shoes wear out over time. A lot of us probably wear our shoes a lot longer than we should, and we lose the stability and support that they're designed to have. So I would say just making sure that we're warming up before activities, wearing appropriate stuff and shoe gear, and just being cautious and careful. If you're going to be out on ice or if you're out in the field, you need to be cognizant of that and try to make conscious decisions regarding jumping across ditches and things like that.
Doctor, if folks would like more information about Dr. Woolley, about foot problems, what they should do, where would they find that?
So the Prairie Lakes website is actually great. If you just go to prairielakes.com, all of that information is available there. And then if you need to get a hold of scheduling, our scheduling department can be reached directly at 884-4232.
All right. Anything else you want to share about this morning?
No, sir. Just appreciate the time and hope you guys have a great day.
Thank you, Doctor. You too. Dr. Eric Woolley, podiatrist at Prairie Lakes Podiatry Clinic.